A non-lump symptom was exactly what Megan Hall, 34, discovered before she was diagnosed with breast cancer. I noticed something green spilled on the front of my shirt. I didn't think anything of it, until I tried to take it off and realized it was stuck to my nipple, Megan told WH. My breast was leaking green fluid. That's right, Megan's breast cancer symptom was green fluid leaking from her nipples, and her experience isn't unique. 1 in 6 women who discovered their cancer themselves caught it based on a less obvious breast cancer symptom, like nipple abnormalities and weight loss, aka not a lump, according to a 2017 study published in the journal Cancer Epidemiology. You know your boobs and all their little quirks, like how lefty fills out your bra so much better than righty, so if you notice any changes to their normal appearance, pay attention, says Deborah Patt, MD, OBGYN, and breast cancer expert with Texas Oncology, a practice in the U.S. Oncology Network. Any unusual thickening, redness, rash, dimpling, or puckering of your breast skin or around the nipple should be checked out by your doctor, she explains. Only mannequins have perfect, pointy, well-behaved nipples. Real, human women have to deal with different colors and sizes, positions, textures, and, gasp, hair. Fortunately, all of these things are totally normal and not a problem as long as they're your normal, says Dr. Denjaluri. For example, if your nips have always been inverted, that's just how you're shaped, but if they change suddenly, going from pointy to fully or partially inverted, call your doctor stat. Bottom line, any changes in your nipples, including their color and texture, need to be checked to rule out cancer, Dr. Denjaluri says. Is there anything more alarming than having your breasts start squirting liquid when there's no baby involved? It's normal to have some leakage during pregnancy while breastfeeding, and up to a year after weaning your baby, but if you notice any discharge any other time, it needs to be evaluated by a doctor, says Dr. Patt. Random discharge, especially if it's red or green or has an odor, might mean you have a problem, including cancer of the breast or the pituitary gland, Dr. Patt explains. Swollen and painful breasts are, well, a pain, and while they're mainly due to hormonal changes, like PMS or pregnancy, they can be linked to breast cancer. It's all about the size and placement of the tumor, says Dr. Patt, which can be responsible for a change in the size or shape of your breast or cause of painful swelling. While the vast majority of women who report breast pain do not have cancer, if breast pain and swelling aren't linked to your menstrual cycle, you're not breastfeeding, and it appears suddenly or doesn't go away, give your doctor a call because whatever is happening needs to be addressed, adds Dr. Patt. How your breasts feel internally can be just as important as how they feel on the outside, says Sherry Ross, MD, an OBGYN and author of Sheology. Some women report feeling a sensation almost like they're being tickled from the inside, their breast feels like it's buzzing or prickly inside, or like their breast milk is letting down, when they're not breastfeeding, she says. Weird feelings can happen for no reason at all, but if you're experiencing strange sensations in your breast that are abnormal and recurring, it's time to call your doc, she says. Does wearing a bra suddenly irritate your nipples? Are your breasts so painful that you have to face away from the stream of water in the shower? Have your breasts become so sensitive that you don't like your partner to touch them anymore? Breasts or nipples that become more sensitive than normal can be a sign of cancer, Dr. Ross says. Breast sensitivity is often tied to hormone changes, which is why many women experience breast tenderness as part of PMS, and it's one of the earliest signs of pregnancy. However, some types of breast cancer can affect your hormones, giving you a similar feeling, she explains. So if your breasts are suddenly way more sensitive than normal and it's not around that time of the month and you're not pregnant, give your doctor a call, she says. Being able to see your veins on the surface of your breasts depends on a lot of things: skin color, amount of subcutaneous fat, pregnancy, genetics, but you should be paying attention to those squiggly blue or green lines, as changes in their appearance can be an early sign of breast cancer, Dr. Ross says. Being veiny in general is nothing to be concerned about, but if you've never been able to see them before and now you can, or if they've suddenly become much bigger, darker, or more prominent, then it's time to be concerned. Visible veins can indicate the presence of a tumor as they require more blood flow and therefore more veins, she explains. Or the tumor may be blocking the blood flow, causing the veins nearby to swell. Sometimes the girls just need a good scratch, especially if you're wearing a bra edged with lace or sequins. Why, bra manufacturers, why? But if your nips are constantly itchy, there's a good possibility something else is up, and you need to get them checked, Dr. Pat says. Many things can cause itchy nipples, including a yeast infection or other infection, allergies, and irritation from clothing. But there is a rare type of breast cancer that can cause a dry, red, itchy rash to appear on or around your nipples, similar to the type you get with eczema, she explains. Regardless of the cause, an itchy rash is one symptom you should always have your doctor take a look at, particularly if it doesn't go away after a week or two. Fun fact, your breast tissue extends far past the circular part you stick in your bra cups. Your breasts actually go along the side of your chest and up into your armpits, Dr. Ross explains. You can get breast cancer in this bonus boob tissue, or cancer can cause lymph nodes in your armpit area to swell, she says. So if your armpits become painful or swollen, and you didn't go overboard on the chest press machine, or you feel a mass when shaving, give your doc a call. Armpit discomfort is a common complaint, and most of the time it's nothing to worry about, but it's always better to be safe than sorry when it comes to your breasts and pits, Ross says. Didn't know that you can get zits on your breasts? It's true. It's not uncommon to get small sores, including pimples and even warts, on your breasts or nipples, Dr. Ross says. For women who work out, you may find them in places you sweat heavily, like between your breasts, or along the line of your sports bra where sweat can get trapped and clog your pores.